In August of 2024, the ADCC held its World Championship grappling tournament in Las Vegas, Nevada. Nicholas Meregali was a top-ranked competitor who was expected to have a great showing in this tournament. Unfortunately, disaster struck for Meregali when during his match with Michael Pixley, he suffered a shoulder dislocation when he was thrown during the match. Ultimately, the damage from this dislocation ended up being so severe that he would require surgery and will likely have to spend a long time off the mats during his recovery time. Hey everybody, and welcome back to the channel. My name is Dr. Caleb Davis, and I'm the host of the Dr. Big Guy podcast. I am an orthopedic surgeon who specializes in shoulder and elbow surgery, and there is nothing I love more than discussing shoulder injuries and the ways that we can treat them and help people get back moving and get back into their favorite sports and activities. Today we're going to discuss Nicholas Meregali's recent injury at the ADCC tournament and break it down for you. Let's go ahead and get into it. In his match against Pixley, you can see that Meregali was being thrown and he tries to catch himself on an extended arm with a nearly fully extended elbow, putting his shoulder into a really vulnerable position for injury. You can see here that his shoulder was in the classic abducted and externally rotated position. Abducted meaning up and away from the body, and externally rotated refers to when the hand is being rotated backwards kind of behind the head. Now this is a classic position for an anterior shoulder dislocation. This is another angle of the injury where you can see it a little bit better with that fully extended elbow when he falls. When he makes contact with the ground here, the elbow is first locked out, causing the shoulder to shift forward. Then the elbow collapses, causing it to externally rotate. And likely this is the moment where the shoulder came out of the socket. I wanted to give a quick shout out to Dr. Michael Piekarski, who is a physical therapist and a black belt in Brazilian Jiu-Jitsu, who provided this video and actually has a really good breakdown on his Instagram and Facebook. His username is Dr_Kickass, and you should definitely check out his content. He's got some really good injury breakdowns in a similar vein to this. And he obviously knows a whole lot more about Brazilian Jiu-Jitsu than I do. Now, I'm not exactly sure whether Meregali's shoulder stayed out of the socket. Sometimes the shoulder will actually pop out and pop right back in. But unfortunately, once it pops out, a lot of times the damage is already done. Sometimes when the ball comes out of the socket, it actually stays stuck in a locked position and cannot be moved back. Other times, the two bones are wedged together, and then the muscles of the shoulder contract tightly, making it almost impossible to go back in. Either way, I'm sure it was excruciatingly painful during this match. Just to reinforce the idea, here's an x-ray demonstrating what a normal shoulder would look like with the ball lined up with the socket, and next to it, when the ball sort of sits forward in front of the shoulder socket. This is the classic appearance of what we call an anterior dislocation, or when the ball goes out the front of the socket. I wanted to show this clip of the rugby player just to show you how common it is for these players in contact sports to find themselves in this abducted and externally rotated position. Now, if you follow the player in the white uniform, you can see them as they fall, that arm, again, similar to the Meregali injury, out in front, up to the side, and as he hits the ground, it externally rotates, causing a dislocation again. Now, as you see him rise up from the ground, you can see that there's a deformity of his arm because that ball is out of the front and locked in that position like we discussed before. Now, there are actually a number of different injuries that you can sustain inside the shoulder when the shoulder dislocates. There's a lot of different structures that could be injured. The labrum is a ring of tissue that goes around the circumference of the socket that offers more stability. When the labrum tears, especially during a dislocation, it inherently makes the shoulder more unstable. Sometimes when the ball is forced out of the socket, it can even take a piece of bone off of the socket with it, chipping it away. When there's a bony fragment involved in the injury, it can make it even more complicated, more prone to dislocation, and usually even more prone to needing surgery to address the problem. I'm showing here now on the screen a CT scan and an MRI of the shoulder demonstrating what it looks like when you have some bony involvement. On the MRI, you can also see a large labral tear that I'm circling here right now. And then there's also a 3D reconstruction of the shoulder socket looking at the face of the socket that shows a chip of bone involved. You can see a little bit more of that bony involvement as you look directly at the surface of the socket. Here we're looking at actual surgical footage of an arthroscopic surgery for an unstable shoulder with a labral tear. If you look at the screen, above us is the ball, below us is the socket, to the right back of the screen is a labral tear, and to the closer to the screen and to the left is some of that bone loss that we described before. Now, I need to make an important note that this CT scan and the MRI and the surgical video that we're all looking at today is not Meregali's surgery. This is a surgical video and presentation from the NYU Orthopedic Library. Now, the younger you are when you have a shoulder dislocation, the higher the chance that you'll have a shoulder dislocation again at some point in your life. And this chance certainly skyrockets when you're a professional, high-level contact athlete. Just one more time to reinforce the concept, here's a depiction on the screen of what a 3D representation of a labral tear would look like in the most classic position off the socket. So how do we fix these labral tears? For most people, a simple labral repair will do the trick. You basically grab some of the capsule and surrounding tissue and the labrum, and then you sew it back to the socket using a special designed anchor. All of this can be done in a minimally invasive arthroscopic manner, meaning we use a camera through some small incisions to do the entire surgery. This sort of arthroscopic surgery is usually a little bit less involved than the Laterjet procedure. I also want to give a quick shout out to the company Arthrex, who was generous enough to let me use all of these graphic representations of these different surgeries you're about to see. Arthrex is not a sponsor of mine, but they do make good quality products that are often involved in these sorts of surgeries. Now, sometimes when you're dealing with a very bad injury or a high-intense contact athlete, you have to do something that's a little bit more involved than just repairing the labrum. Now we're going to get into a surgery called the Laterjet procedure, and that's the surgery that Meregali had performed on him. So the Laterjet procedure involves actually cutting a piece of bone out of the front of your shoulder called the coracoid. We then transfer that bone and actually attach it to the front of the socket with a pair of metal screws. And then we can rebuild the socket and make it bigger and more stable. The coracoid bone also has a tendon attached to it that creates a sling effect that helps keep the ball inside the socket and not let it come out of the front. Now, both of these procedures have their risks and benefits. A labral repair is considered less invasive and has a lower chance of infection and potential nerve damage. However, with a labral repair, sometimes you are less likely to be able to return to the same level of sport, and you're at a higher chance of a redislocation after the surgery when you compare it to a Laterjet procedure, especially when dealing with high-intensity contact athletes like Meregali. The Laterjet procedure does have a higher chance of potential complications, but is associated with a higher rate of return to sport and a lower dislocation rate. So just on a personal note, since I do actually perform Laterjet surgeries, I can tell you it is a much more involved, complicated surgery and is more invasive. And there is also a higher risk of nerve damage. There are two nerves in particular that you work very close to during the surgery. The musculocutaneous nerve, which controls your biceps, runs just below the coracoid, the bone that you're actually cutting into and transferring. And then the axillary nerve is running just below the socket, and that's the nerve that gives you motor control and function of your deltoid muscle that helps lift your arm. So as you can imagine, a complication involving either of these nerves would be devastating. Fortunately, the evidence of nerve damage is usually pretty quickly apparent after surgery, and there's no evidence that Meregali suffered any sort of complication from his surgery. I did briefly want to touch on the biceps tendon because Meregali mentioned in one of his social media posts that his bicep tendon had ruptured and it required surgery to be reattached. Now, there are actually two biceps tendons that run up through your shoulder. One is called the long head of the biceps, and the other one is called the short head of the biceps. The long head of the biceps runs up the shoulder through the shoulder socket and attaches at the top of the socket. The short head of the biceps then joins another muscle called the coracobrachialis and turns into the conjoint tendon, which attaches to the coracoid, and that tendon becomes the sling that creates stability for the shoulder after the Laterjet procedure. Now, typically the biceps that ruptures during this sort of injury is the long head of the biceps, and so I can only guess that's what happened to Meregali. I don't know exactly what type of surgery Meregali had to have his biceps repaired, but typically it involves drilling a hole in the bone, passing the tendon through that hole, and then securing it with some sort of screw. Now, any shoulder surgeons out there might argue with me about exactly how it's done because there's 1,000 different ways to do it, but that's basically the gist of it. Now, if you fail to repair the biceps, you can get something called a Popeye deformity. A Popeye deformity is essentially where the biceps muscle bunches up at the bottom of the arm and creates a deformity that resembles the cartoon character. This sort of deformity is usually associated with pain, weakness, muscle spasms, and a permanent cosmetic deformity. Now, just as with most surgeries involving professional athletes, the rehab portion after the surgery is often just as important and crucial as the surgery itself. Even if the surgery goes absolutely perfectly, sometimes the rehab portion can be even more painful than the surgery. Typically, a patient who has had a Laterjet surgery will be in a sling for a couple weeks, but they'll get back into physical therapy fairly quickly. A physical therapist will help them to do what we call active assisted range of motion and passive range of motion, where they're not having to contract their own muscles to move their shoulder around, and the therapist will use different instruments and tools or their own hands to help move the joint around and get a little bit more mobility back. Once you start having more painless range of motion, that's when you can start doing some strength training, and then you'll start progressing to more sports-specific exercises that will apply more to the dynamic movements that whatever sport you participate in would look like. Obviously, every single patient is a little bit different, but you can expect anywhere between 5 to 6 months from the surgery to be a reasonable expectation on when you might get back to your sport. So you can see here in this video that Meregali has already posted some videos of him doing his rehab work. You can see here first in this clip that he's using these TRX bands to help him hold his shoulder up without having to actually contract his deltoid. This is similar to that active assisted range of motion we talked about, where the band is holding his arm up and he's not having to contract his deltoid, but he's able to lean forward to get some range of motion back. In this next clip, you can see that he's doing some exercises that help isolate the muscles of his scapula, but are avoiding moving his ball and socket joint. Scapular strengthening exercises are crucial for any portion of shoulder rehab. So that pretty much wraps it up. There's my full breakdown of Meregali's injury and why I think that the Laterjet surgery was likely the appropriate choice for him. I'm wishing Meregali a speedy recovery, and I'm hoping he's back in top-notch shape for the next ADCC Championship. If you have any questions or want to see more content like this, don't forget to like, comment, and subscribe. And don't forget to check out the Dr. Big Guy podcast for any of your wellness and injury prevention needs.